Hi, I'm Dr. Paul. Welcome to another episode of Ask Your Pediatrician. The topic for today is headaches. Headaches in children. When should you be concerned? And we're also going to touch on migraines. So the headache that every parent is worried about, every time your child has a headache, you're thinking, oh my gosh, they must have a brain tumor, right? Well, thankfully, it's probably not a brain tumor. In fact, I can almost guarantee you, no guarantees in medicine, but literally in 25 years of pediatrics, I've had less than I can count on one hand brain tumors. I've had headaches in the thousands, okay? But let's address that headache that might be a brain tumor. This is a headache that gets worse and worse and worse, day after day after day. It's often constant, and it's especially bad after you've been laying down for a while. If you think of pressure developing in your head, and when you're laying down, gravity hits, so it's that headache that wakes that child up in the middle of the night that's at its absolute worst first thing in the morning. Those are the ones you're going to worry about the most. You don't wait very long with a headache that's like that. It's waking your child up in the middle of the night. It's there. It's at its worst first thing in the morning, even if it's only been a week or two. If that's the pattern, get in and see your physician, your healthcare provider, somebody who really knows how to look at the back of the eyeballs, look at the discs, make sure they're sharp, and when in doubt, you can always do imaging. But like I said, for the thousands of headaches I've evaluated, I would say, I've had to send off for an MRI of the brain a handful of times because that's just not the pattern, right? The most common pattern for headache is that headache that's kind of worse as the day progresses, and that's more of your tension headache. It's sort of like a band of pressure classically, although kids don't always give you that classic, feels like I've got a tight band around my head, which is what you think of with a tension headache, worse as the day progresses. You can have a headache behind your eyes if you're, perhaps you've got some eye strain, happens at school, either just because of schoolwork or too much screen time, or perhaps you actually have a visual issue. So having the eyes checked is important. Making sure the pattern doesn't look like that pattern for a brain tumor kind of headache. And then I want to touch on migraines. So the migraine headache, classically, there's this thing called an aura. So sometimes people with migraines will describe that they see flashing lights or they have some awareness that it's coming. And then they get this most intense headache that's throbbing typically, and nothing helps it except laying down and being very still in a dark, quiet place. And usually if patients with migraines will do that, within a few hours, it goes away or gets much more manageable, and it may return again. There's often a family history of migraines if you have migraines, and what I've stumbled on with migraine headaches, as far as the cause, wouldn't it be nice if you could figure out what's triggering that migraine? Because something's triggering that vasospasm that's creating that just intense pain in your brain, in your head. And very often it's MSG. Now MSG, monosodium glutamate, is a flavor enhancer. Of course, it's been banned, don't you know, and you can't put MSG in food. And you go out to the restaurants and they'll even say, no MSG. Well, folks, it's a little more complicated than that. What's happened is the Glutamate Society has been able to get legislation passed so that MSG can be hidden as natural flavors. So as long as it's not pure MSG, they don't have to label it as MSG. So if you're eating anything in a bottle, in a can, in a bag, anything processed, anything fast food, you can count on it that they've used sauces, they've used spices, they've used natural flavors, probably MSG. I have a daughter who suffers from migraines. Almost always it's when they're on vacation because they don't have the ability to cook their own food and they're eating out and they're getting exposed. So avoiding MSG is a big one. Another trigger for some people is artificial dyes and colors. So, just stay away from bright colored anything unless it's natural food. Those are going to be triggers for some people. And then it can just be stress, not enough sleep, and stressful situations which could trigger it. And so you want to just take care of that general, good health habits. And finally, I would say in the diet arena, there are certain foods that can trigger migraines for certain people. You can do a food sensitivity panel, IgG, and just see if there's a huge reaction immunologically to certain foods. But a lot of times, like I said, it's going to be the MSG, the artificial dyes and colors, that are going to be your big triggers for migraines. Now, that was migraines. There are other types of headaches. Most often, these are not serious. They're going to be passing. The situation where a headache also needs immediate attention is after a head injury. So if your child might have had a head injury and they've got a headache, especially if they start vomiting, you don't wait till tomorrow. You need to call your physician or get them into your doctor, urgent care, emergency room, because headaches acutely, immediately following a head injury are a bad sign. Now, obviously you bonk your head, you're sore, that's not what I'm talking about. I'm talking about a progressively worsening headache. I hope that was helpful. Please leave your questions, comments, like us if you found this helpful, subscribe if you haven't, supports the channel. I'm Dr. Paul. Thanks for watching.